Hello, everyone. My name is Mu Tianding. I also go by William, and I'm incredibly honored to receive the 2026 Stephen Husing Scholarship. Just want to say a massive thank you to Digital Health Canada for this privilege. So, my journey into digital health began when I realized the immense potential for technology to improve both the safety and the efficiency of patient care. This drive led me to conduct a research project in virtual surgical planning for maxillofacial reconstruction. We developed an algorithm to automatically segment the fibula and its surrounding arteries. So, in simple terms, we create a tool that tells surgeons exactly how much blood vessel is available before they make an incision. And this has helped us to avoid unexpected complications, reduce surgical stress, and ultimately makes the procedure much safer. I have to give a huge thank you to my principal supervisor and mentor, Dr. Joel Davies, who has been instrumental in guiding me down this path. So, beyond the operating room, I'm just as passionate about digital health in medical education. Medical students have notoriously packed schedules, which makes it hard to consistently practice clinical skills. So, to solve this, I spearheaded a project called Techni Academy. And essentially, it's a platform where students can practice clinical scenarios together with an AI agent. And the system would evaluate the student performance against a rubric in real time, provide feedback to their performance, track their progress, and can even compress hours of lectures into clean, organized study notes just within few minutes. So looking ahead, we're building tools to train the most critical part of a physician's education, which is clinical reasoning. We want to help students logically narrow down differential diagnoses and connect concepts from day one of medical school all the way to the clinical days. So essentially, we want to turn isolated medical facts into an interconnected web of knowledge. And ultimately, what excites me the most about the future of digital health in Canada is really the fact that AI will become an indispensable partner, improving the efficiency of our healthcare system, the safety of our surgeries, and the education of our future practitioners. Thank you again for this incredible honor.
Hi, everyone. Being recognized with the Stephen Husing Scholarship at eHealth is an absolute honor. I was first inspired to pursue a career in digital health when I experienced some of the challenges of transitioning between primary care to the acute care sectors firsthand. This is where I saw a massive opportunity for digital health as it sits at that intersection between data, digital, and healthcare delivery. I'm particularly interested in aspects of implementation science and how do we bring an idea from a conception to a reality in such a way that it transforms the lives of clinicians and patients. As you look around, we're surrounded by some of the brightest in the digital health space today, who collectively have the ability to transform how healthcare is delivered such that it is integrated, scalable, and supports the diverse needs of our populations. And it's particularly this aspect that really excites me about the prospects of digital health in Canada for the future. So to my mentors and my colleagues, thank you so much for challenging me and for continually reminding me that collaboration, perseverance, and creativity can really take us a long way. And thank you again for eHealth for this incredible recognition. It serves as a powerful reminder for me that the work that we do is not just about the technologies that we build, but it's also about the ability that it has to transform the lives of patients and clinicians. I hope everyone has a wonderful time at the conference. Thank you again.
Receiving the Digital Health Canada Future Leader Award is such an incredible honor. It represents not just a personal milestone, but a reflection of the mentors and colleagues who have supported me and believed in the future of a digitally enabled Canadian healthcare system. I've been fortunate to learn from some of the most passionate leaders in digital health across Canada, and their commitment has inspired me to think bigger about what's possible. At this time, I strongly believe that we are at a defining moment in healthcare. We have an opportunity to move beyond digitizing existing processes, but instead reimagine how care is delivered, how it reaches people, how it empowers them. And for me, that means building a future where digital just doesn't sit at a clinic or a hospital, but becomes seamlessly embedded into daily life, supporting patients, families, and communities wherever they are. The challenge I'm most passionate about is really unlocking this vision Today, healthcare is still quite fragmented and difficult to navigate, but we are surrounded by data, tools, and innovations that, when brought together meaningfully, can transform that experience. And so I have the most fun working alongside our clinical and informatics leaders to rethink care models to make them more proactive, more personalized, and more sustainable. What excites me most is the idea of untangling complexity. How we look at using digital tools to not just to capture information, but to generate insights that clinicians can trust and patients can act on. Looking ahead, my goal is to shape a healthcare system in Canada that is truly digitally enabled and future ready. One where technology helps us deliver care that is more precise, more equitable, and more human. But I believe this future can only be built through close collaboration and partnership. So I'm really excited to continue to work alongside the incredible leaders in this room across Digital Health Canada to turn that vision into reality and to help more Canadians access the care they need when and where they need it.
Hi everyone, my name is Samira Rahimi. I'm Canada researcher in AI and advanced digital primary healthcare and professor at McGill University and Mila Quebec AI Institute. My research focuses on developing and implementing AI-enabled technologies that can support preventive care, improve health outcomes, and help make healthcare more accessible, proactive, and person-centered. I'm really honored to receive the Digital Health Canada Future Leaders Award, and I would like to thank Digital Health Canada for this recognition. When I heard the news, my first thought was about the many, many people who have been part of this journey with me. While the award is in my name, but it really reflects the support, guidance, and collaboration of many, many colleagues, mentors, trainees, patients, and community partners who have shaped my work and perspective over these years. One thing that I learned through the years is that leadership in digital health is not really about the technology, but it's really about the people. Technology can be super powerful, but on its own, it really doesn't change the healthcare system. Real impact happens when we understand the needs of patients, caregivers, and healthcare providers and design a solution that really fits into their life and work in a meaningful way. And one of the challenges I'm most passionate about is making sure that digital health innovations are not only effective, but also accessible, trustworthy, and practical in real world setting. So we are seeing incredible advances in areas like AI, but many technologies never reach their full potential because they are difficult to adopt. They don't fit the existing workflows or aren't designed with end users in mind. So, looking ahead, I hope to contribute to a future where healthcare is more proactive, personalized, and preventive. A future where technology helps identify health concerns earlier, support people in maintaining their health and independence, and provide care team with better information to make decisions and deliver the best possible care. For those who are entering to the digital health field, my advice is to stay curious, keep learning, stay connected to the people who you are hoping to serve. It's easy to become excited about these new technologies, but the most successful innovations are the ones that solve real problems and make a positive differences in people's life. Thank you again for this recognition, and I look forward to continuing this work alongside so many talented and passionate people across the Canada. Thank you very much.
This is kind of a recognition for me, but also for clinicians. It's not often that you have clinicians that are also physician leaders in digital healthcare. And it's a bit of a transition that we're seeing over the last couple of years where it's been more government health system leaders and vendors, and physicians that were there tend to be hospital-based or academics. But now we're starting to see more and more clinicians that are actually boots on the ground, and they've been kind of raised into leadership roles. So I have to say I'm really excited because it also shows that as a like a family or as a health system, we're starting to really look at how digital health is adopted where we actually see the most patients in the country. when you're a physician, this isn't what you're trained for, right? You're trained for something totally different. So I did 20 years of family practice in the community. And so digital health was just kind of like what you did from becoming a paper to like an EMR. And you don't actually think of it as a leadership journey. But since then, I've been with Ontario MD as their chief medical officer. And I find that what I've learned actually a lot is about collaboration. And when you actually meet people, everyone really has their heart in the right spot, right? It's really all about patients. And so whether you're government or a vendor or a clinician, everyone kind of has this idea that we're doing it better for patients. And so what I'm learning is that collaboration is where we need to figure out where we go. So it's a nice environment to be in. So you know what? I think it's bringing in teachings from elsewhere, right? We're really not leveraging that, right? We don't have enough speakers or enough like kind of just that lessons learned like from Australia, from the UK. Today there was some great talks, but I think that needs to be bigger. And I think we really need to start looking at other countries, other systems, and bring it together as a forum here. And I think Digital Health Canada could totally do that because no one else is doing it because we're siloed by province. So you really need to start pulling that in. I don't know about legacy, but what I'm hoping is that I want people to start understanding that clinical and digital are not separate. You can't go and have a clinical conference and then do a digital conference, not if you want patients. So we need to start pulling them together so that as you go to a clinical conference, the digital is there. Because I believe that clinical dictates digital, and digital is just another tool. But we are still thinking that digital is going to solve all the problems. But you still need to look at the people, the process, and the clinical. And then digital might be the answer, right? So I would love the impact and legacy to be finally for people to start shifting from here's AI, it's going to save your whole system, to let's figure out where the problem is. And I think AI is actually going to help in this place, but not as a global panacea. So, yeah.
First off, thanks so much to Digital Health Canada for the recognition. I think what this means to me at this stage, I mean, there's nothing more meaningful, I think, than an award that comes and is voted on by your peers. And so it's incredibly validating of the approach that I've been taking over the last several years with respect to how we're trying to integrate artificial intelligence into routine care delivery and healthcare system, but to do it in a way that's really responsible, careful, ensuring that equity is at the heart of everything we're doing. And really measuring clinical impact with a high degree of rigor to make sure that we're making the right kinds of investments. And so it's very validating of that approach that we're, I'm on the right path and really need to double down. So, yeah. I think one of the things that's really changed for me over time is really, even though I'm working heavily in technology, I spend less and less time really thinking about technological leadership. And more I'm thinking about the clinical and organizational dimensions of technology projects. And I think this has been more true of AI than almost any other form of technology I've done. We've really started to realize that, the AI piece, it's important, and I don't want to downplay the importance of AI models, but to actually achieve clinical impact takes integrating AI deeply into care pathways. And it's about understanding the root cause of the clinical problems that we hope AI is going to help us solve, and working with clinicians to figure out how AI can actually be seamlessly integrated into the care that they provide. And that's about thinking about things like human factors, thinking about, people management, implementation science, and in a way that it kind of goes beyond just thinking about technology and data. I think right now what's sort of top of mind is having completed recruitment of the first randomized control trial to be conducted on a Canadian-developed AI product. And this is something that we built in Hamilton Health Sciences, trained an algorithm to help us optimize the use of invasive cardiac testing versus non-invasive testing to ensure that patients get the test that's right for them. And this is going to both save the healthcare system a lot of money, but also really improve outcomes for patients because inappropriate invasive testing can result in really serious, rare, but serious morbidity and mortality. And so, being able to prove without a doubt, right, with the highest quality of evidence that this AI product really can work in a live environment, can improve outcomes, reduce costs for the system, and address existing health inequities, particularly for women who are facing a much higher risk of these iatrogenic effects without a chance of therapeutic benefit compared to men. Showing that this AI product completely eliminated that discrepancy was hugely meaningful for me. What I'm really hoping is that a big focus of my work has really been expanding the conversation around artificial intelligence to get organizations to really think about the kind of value that they should be thinking about when they're planning AI interventions, and really putting the quintuple aim at the heart of the conversation. So to not just talk about how we can improve efficiency, which is how a lot of discussions around AI rotate, but how we can really use it to enhance health outcomes while simultaneously improving provider experience as well as patient experience, and most importantly, health equity. And making sure that you can actually achieve all 5 of those, right, when you're actually launching an AI or really any digital innovation. And I think that's something that has been really important in distinguishing my work, and something I have really focused my educational efforts on, really teaching people how to integrate that perspective into their day-to-day work.
Validating the hard work that we are doing every day and trying to get this off the ground. The platform has been supportive.
Being able to talk about the positives is motivating.
We certainly provided an avenue to help with those emergency room wait times, closures, lack of public health accessibility.
The initiative was designed to address the ER closures, the ER wait times, and lack of primary care physicians in our community. Patient care and clinical outcomes have been improved by being able to reach more patients and population in a more timely manner. Collaboration is so important with a platform this size. I think being creative was a big one, learning to work with different doctors who have different ideas and different ways that they come to conclusions. Also working with different patients where no two have the same concern when they come before us. I think that what excites me most about the virtual urgent care platform is being able to reach an even wider population to support our communities, and also being able to offer more services through our platform.
Coming from the virtual care clerk, it means our platform is being successful in having patients seen, and we have virtual care that can get them seen a little bit quicker. So that means winning this award means our program is effective and it's helping the community.
In rural health, a lot of our patients in the community, they don't have family doctors. We don't have a lot of emergency doctors, so we only have 1 emerge doctor on per shift. So our wait times can be 10 to 12 hours, and people that are not acutely ill, they're waiting longer periods. Virtual care has improved our patient outcome immensely for Queens General and surrounding areas. Patients are not waiting as long as they were due to virtual care. They're able to see a physician within a few hours or less. If it wasn't for collaboration, funds would not be as successful as it is, especially within rural health. We collaborate really closely with the emergency department.
The patients themselves do not need to use anything of the technology. You just need to be able to listen and be able to speak with the doctors over the iPad.
It's making more accessible healthcare for people.
You don't even have to leave your home for some
just to see a doctor. Yeah, you don't have to leave your home. You can get your prescriptions refilled online. You don't have to wait a long time in the emergency department.
It's exciting times for our rural areas that have lack of doctors.
Yeah, it's great.
Hi, Justin Hartland here, CEO at Virtual Hallway and also one of 4 co-founders. I was lucky early on to bump into the other 3 guys who are psychiatrists, and they had this unique insight that the access to care challenge in Canada isn't just that we don't have enough doctors, but rather that the doctors we do have don't have access to the knowledge and information that they need for the patient in front of them in an efficient way. So we've set out to build a suite of tools that help doctors get the information they need in a really efficient way so they can put better care plans in place for their patient. we couldn't have reached the scale that we have, where you have the majority of doctors, as an example in Nova Scotia, using the platform without organizations like Nova Scotia Health recognizing the importance and sharing in the vision of what we're up to. And so I think back to these early conversations we had with Dr. Akshay Miller, with the Nova Scotia Health Innovation Hub, and getting alignment on how this sort of grassroots innovation could potentially serve system priorities. It was really with their vision and with their help that we're able to figure out what this needs to look like at scale. How do we work with organizations like Doctors Nova Scotia, the Nurse Practitioners Association of Nova Scotia, the college, to allow this tool to be all that it can be? And so thank you to our collaborators in the ecosystem for helping us grow Virtual Hallway. Thank you to organizations like the Can Health Network for giving us exposure and scale across the country and helping us understand what's happening beyond our borders in Nova Scotia. Thank you to Digital Health Canada for running such great programming and bringing this community together, from the health system partners through to all of the vendors out there that are working on some amazing tools. One of the prompt questions is, what excites you about the future of digitally enabled care? And when it comes to that, like many of you, of course, we're incredibly excited about what AI can do. We've been building this network of human specialists who are helping out other doctors, and we're now able to combine that with AI tools so that when a physician on the front line has a question, whether they need to speak to somebody, engage with an AI tool, or engage with learning content, as rapidly and efficiently as possible, they can get the exact Canadian contextual information they need for the patient in front of them. And I think that's so cool. I think this whole space has been cool, but is really at the start of something incredible. So cheers to everybody out there, and thank you so much for giving us an opportunity to share this video and for recognizing the work that we've been doing.
To me, it means that the conversation is maturing. For a long time, the focus has been on digitization, making sure that we move to electronic health records, but the challenge of connectivity and interoperability has remained. This award today means that we are now putting priority on interoperability and making sure that our clinicians have a full trajectory on all of our patients, which they deserve. I lead the digital health work at the Montreal Centre West Health Network. We cover acute care, primary care, long-term care, rehabilitation, community care. And a problem we were facing was that we have a lot of older, disparate systems, and it was hard for our clinicians to put together the full patient trajectory. The patient timeline solves that problem. It's a real problem that we faced every day by providing one innovative web-based view built on the FHIR standard, so that our clinicians have a rapid way to look at the full patient trajectory. So I think our work is really fully aligned with the Pan-Canadian Interoperability Roadmap. Several priorities around the priority around improving clinician access at the point of care and improving care coordination and collaboration. So we've seen savings just in chart review activities and how fast this is, of over 1,000 physician hours saved, over 11,000 other health professional hours saved since the launch of the timeline. You can't do everything else without it. You can't do the AI, the analytics, the care collaboration, the patient access to their own records without having a strong foundation based on interoperability. So we're trying to solve that foundational layer right here. Our initial goal was to solve a real problem right in front of us, which was to give time back to our clinicians by de-siloing all of our different legacy systems. I think we've been successful in that goal, but beyond that, we built this in a standards-based approach with a FHIR basis because we knew that other jurisdictions struggle with the same challenges we do. And I think, we think that this could be very helpful to other jurisdictions across Canada. And one last thing, I just want to say thank you to our team at Jewish General Hospital, Studio Centres, and also our partner, Harris Healthcare, a Canadian firm who has been great with us on this journey so far.
Congratulations, Naomi, on the Digital Health Canada AI Innovation and Emerging Technologies Award. The BC Scribe trial is one of Canada's largest coordinated real-world evaluations of 6 ambient AI scribe technologies. Can you tell me a little bit about what was your role in the trial and what inspired your team to explore this technology or approach?
Thanks, Angel. My role was the executive director for health information management. So I supported the business operations of this work. And really, our work in health information management is so deeply connected to the clinical frontline through clinical documentation tools and standards. As a strategic partner and enabler in this space, it was a natural fit for us to explore and help shape this approach to support clinicians and improve documentation quality. We see this as an important step in strengthening the foundation of high quality, data-driven care across the system.
What possibilities or opportunities are you most excited about moving forward from this trial?
I'm most excited that our evaluation has demonstrated not only quantitative benefits, but also meaningful qualitative impacts, advancing equity, effectiveness, safety, and timeliness of care. This documentation tool has strong potential to reduce administrative burden and clinician pajama time while enhancing both patient care and the quality of clinician-patient interactions. We are optimistic about the role it can play in creating a more sustainable human-centered care experience for both providers and patients. So over to you now, Angel. What problem was the BC Scribe trial designed to solve, and what role did you play in leading this initiative?
I am the Chief Medical Informatics Officer of Provincial Health Services Authority in British Columbia. And my job was to really address this new reality that the public healthcare sector is facing, which is the concept of bring your own AI. And I think while these technologies are definitely showing that they are being helpful for clinicians in terms of reducing administrative burden, our job from a health authority standpoint was to make sure that these tools were being used responsibly. And so my role was really to lead the governance evaluation of these tools across multiple health authorities and across different settings and across different vendors. I think too often healthcare organizations focus on whether or not an AI tool is innovative or exciting and then uses that as a reason to adopt it. I think what's more important is that we adopt tools that are actually meaningfully improving outcomes for patients as well as clinicians and the healthcare system. And just like any other new intervention in our healthcare system, we need to make sure that there are ways to evaluate the safety and effectiveness of these tools, like we would a new procedure or a new drug intervention. And so using robust scientific clinical trial approaches to evaluate AI tools is a must. And that's what we try to do in the BC Scribe trial with randomization and scientific approaches as well.
Good evening. I'm sorry unable to be there in person. I'm deeply grateful to CHLNet and Healthcare Excellence Canada for receiving the Monotone Award and humbled to be in the company of its previous recipients, many of whom I've had the privilege of knowing and whose achievements I greatly admire. This award is particularly meaningful to me. Serge Taillon was once a student in my introductory statistics course in the MHA program at the University of Ottawa in the early 1980s. We became friends over the years and stayed connected. He was a true builder at CIHI. While Don McNaught contributed to the task force that led to CIHI's creation, I remember him most as one of Madame Monique Béjean's three musketeers who helped draft the Canada Health Act. She fittingly referred to Don as Mr. Medicare in her 2018 memoir. Most of my 48-year career in healthcare has been spent at the Canadian Medical Association. In 1990, Bill Thal hired me to direct the physician survey program, which soon evolved into policy work. One of the most impactful developments came in 1999 with my colleague Linda Buskey's physician supply projection model, which clearly showed an impending and dramatic drop in physician supply. I believe this work played a key role in reversing the enrollment cuts made in 1993 by governments and the subsequent correction in terms of increasing training capacity. A central lesson from that experience is the importance of tracking the consequences of policy decisions with timely data and adjusting course when needed. Looking ahead, I see three both opportunities and challenges to improving healthcare through digital technologies. First, We need to fully embrace virtual care, including secure messaging and remote patient monitoring. Second, we should revisit the 2009 Senate report on population health, chaired by Dr. Wilbert Keon. The report reminded us that there is more to health than healthcare, and that social determinants account for about 50% of health outcomes, compared to at most 25% for healthcare. A 2015 European study suggesting that health inequalities drive 20% of health spending underscores the importance of better data. Electronic records could help us better understand these relationships. Third, we need to enlist AI in the partnership between patients and care providers. Finally, as I reflect on our shared purpose, I am reminded of Health Canada's mission to help Canadians maintain and improve their health. Thank you very much.